Fellowship of the Great Physician welcomes you to House Call. Our hosts today are chiropractic physicians, Dr. Gerald Lala and Dr. Richard Jensen, practice in Roseville, Minnesota, and Dr. David Schwittert in Rapid City, South Dakota. Let's join our hosts for today's program that will assist you in your quest for optimum health and well-being.
Hi everybody, I'm Dr. Jerry Lala.
I'm Dr. David Schwittert.
And I'm Dr. Richard Jensen.
Great to have you with us today on this dimension of House Call. As the screen says, we're going to talk about enjoying normal digestion, and that's a complex subject, but I think my esteemed chiropractic physicians here are on top of that, and we're going to start with a rather lengthy letter that we received from one of our viewers, and it's not a complaint. At least she's telling us that she's got some problems, and we're happy to address your questions. They can come by email or mail or telephone, whatever. So feel free to continue to contact us if you like. Dear House Call Doctors, I enjoy your television program. It's very enlightening and helpful in understanding natural health. My particular concern involves my gastrointestinal system. I have intestinal gas, bloating, alternating diarrhea and constipation. I have to be very careful with the foods I eat, as many foods upset my bowels. My medical doctor has had several x-rays and a colonoscopy performed on me, and the test results are normal. I did not have any polyps, but he said that I probably will get them if I continue to have these gastrointestinal problems. That's encouraging, isn't it? He has also tried several different medications, none of which have given me much relief. Do you know of any alternative tests or treatments that might be helpful to me? Could you explain how the digestive system works? My gosh, you're thinking we're back teaching in chiropractic college here with all this information.
Really good question.
Lastly, could acupuncture treatments or chiropractic spinal care be helpful to my problems? Thank you, and this letter comes from a lady in Sarasota, Florida. So, Dr. Schwittert, how'd you like to take a shot at those questions?
Well, where do we start? I mean, it's a big subject, and you know, maybe as we try to break it down and look at the gastrointestinal system, you know, you might think of from the mouth to the anus or to the eliminatory tract as a big long tube with different sections in it doing different things. And of course, you know, when we look at it from a whole person perspective, we know that there are a lot of different things that can affect how food is transported down through the pipe. You know, how do we take energy out of the food that we get and how we eliminate it? I mean, it's a very complex subject, and of course, as our lady that wrote in has found, there's the dimensions. I mean, she's had really good medical care. She's had, you know, the x-rays and the barium studies and maybe even some MRI studies on the gut. She's said, well, we haven't found any pathology yet. You don't have any cancer, but boy, you know, there's some bad things coming if something doesn't change. So it is really a dilemma. Not only does this letter reflect that, but other kinds of letters that we get like this. They say, well, I don't want to wait. You know, really, what people are saying is, I don't want to wait till I get a degenerative disease that they've got to have some emergency surgery or some kind of catastrophic surgery to do. What can I do to change it? I think that's what really brought our viewer to write us. So let's look at some of the things. And remember, we're talking multidimensional now, so we're going to break it down and just look at these one at a time. One of the tests that can be helpful is what we call the intestinal barrier test. Well, what does this do? Well, it's recommended for people who are suspected of suffering from, and let me just list off some of the problems that this test would be helpful for. Increased intestinal permeability, irritable bowel syndrome and malabsorption, candidiasis, food allergies, chemical hypersensitivity, people who are fatigued, abnormal immune cell count and function. And that doesn't necessarily have to mean AIDS and some other kind of really degenerative disease that can affect your life. But the immune system, really, I mean, think about it. If the immune system isn't fully functioning, it isn't going to respond to the challenges that we are occurring in our normal everyday life. Also, the intestinal barrier test can be helpful to those who are post-operative stage or at risk of infection. The test also provides an excellent tool for detecting some of the most common causes of altered intestinal permeability. What does that word mean, intestinal permeability? Well, think of it this way. If you eat a carrot and it goes into your mouth, unless the body does something with that carrot or the pieces that are chewed down, it's going to come out a carrot. It's not going to be broken down and utilized for energy. And the reason, I know it sounds trite, and I'm not trying to oversimplify, but if our body, the human body, the way God designed it, is an energy consumption machine. It's just like the car that you drive or the bus that you ride in. It has to get from point A to point B somehow, some way, and it's fueled in either case, if it's transportation, jet fuel or diesel fuel or gasoline. It has some mode of fuel. Our bodies, being a biomechanical being that God designed, we believe, it breaks down food into energy. It breaks it down into fats and carbohydrates and proteins, and those have an effect on our body, and they're utilized in different ways. So, this particular test, this intestinal barrier test, can detect some of these causes of altered permeability or absorption, and also poor assimilation. Now, why is that important? Poor assimilation of essential nutrients. Well, just because you eat something does not mean that it's going to be absorbed. Think about that. I'm going to say it again. Just because you eat something that's good for you does not mean that you're going to absorb it. Or just take a nutrient like calcium. I mean, there are certain forms of calcium that are fairly impermeable to absorption, like rock or dolomite. Very impermeable. Or we could go to the other extreme and find things such as calcium orotate, calcium, very easily assimilated form of calcium. The bioavailability, meaning that it is ready to be absorbed, especially when it's bound to protein. These assimilated forms cost differently, right? So rock and dolomite, those are very inexpensive forms, and then the calcium orotate is a more expensive form. So you kind of, in that sense, you get what you pay for. Other types of, let's go on and talk about other types of tests that are also important and complementary as we go through your unique factor, right? The chem screen and CBC blood tests. I mean, the chem screens, these are basic metabolic tests that a lot of doctors, orthodox and alternative health doctors can use that kind of give us a base function of different organs and systems within the body. Another important test that we find especially helpful in today's society is delayed food sensitivity tests. People who are hypersensitive, allergic to different foods and environmental factors, this test can be really helpful so that we can recommend or make recommendations that are bio-individual or specific to that patient, so that we can decrease the amount of hypersensitivity. We can quiet down that immune system response that's going on within the body. Urinary endocrine test is a test is a byproduct of putrefaction of protein, and it is another helpful test. The dysbiosis metabolic marker test and hormone analysis, other two tests. Dysbiosis meaning that when we have an abnormal synthesis of markers that show up in the blood and the urine and so forth, we can find out, is there an imbalance of bacteria in the body? Because we have symbiotic relationships with bacteria and viruses and other protozoa within the body. I mean, we have an intestinal, a gut flora that we're going to be talking about that's normal. And when we take drugs, certain types of drugs can be harmful. And I'm not anti-drug, we're not saying that at all. But there are certain drugs that are harmful to this normal gut flora. And as our reader has shown and said in her statement, you know, she has a lot of problems with gas and other types of bowel problems. Well, when this intestinal flora gets out of balance, no matter what you do, more drugs is not necessarily going to reestablish that normal intestinal flora. And unless you do the testing, you don't know. So let me say that again because I went by it pretty quick. If you don't test, you don't know. And so again, we're talking about shotgunning things and what ends up being, well, we'll try this, we'll try that. Well, wouldn't you really rather narrow it down and say, you know, this is really what's going on, and these are the things that I'm going to need to address that issue and rebuild it. And these tests that we've just listed off, although considered orthodox, unless you put it together as a package, you really don't know, and that's what is so important. So I'm going to turn it over to Dr. Jensen, and he's going to lead to the next dimension of our subject today. Dr. Jensen.
Thank you, Dr. Sweetert. Well, it's very important to note how these tests check you as an individual. You are not just what you eat, you are what you absorb, actually. And so the absorption of things into your body through the intestinal tract is very important. Now, to bring it down to who you are as an individual, you were just watching Dr. Sweetert, who has blonde hair, blue eyes. Where I myself, I'm a brunette, and I have brown eyes. These are the same kinds of protein are found in both the hair and the eyes. However, they change through the genetics. Our individual genetics change these things, and so what happens is the chemical or the molecules that form these proteins will have little changes in their electrical makeup and therefore take a different form, and in so forth doing, they reflect light differently. Therefore, Dr. Sweetert's eyes reflect more of the blue spectrum of light, and mine reflect more of the brown spectrum of light. Why am I getting into eye color? Well, the difference is that we have different shapes of protein, and those proteins can act differently on the body. We were just talking about minerals and how it's very important for minerals to have a protein bonded to them to be absorbed. Well, if your protein reacts just a little bit differently than mine, yours might absorb better than mine, or mine better than yours. So it gets down, when we do the testing, we can see how you might absorb things better or worse in certain areas, where I absorb better or worse in different areas than yours. So it becomes important to know where you are deficient as to which things to give you so that your function of your gastrointestinal system and everything else falls in line. Now, Dr. Sweetert was talking about how it's very important for the immune system. Your gastrointestinal system has the second largest, it's the second largest body surface area that you have. In fact, if you took the large intestine, or no, the small intestine, and stretched it out, it's full of a lot of little undulations, and so we stretch it out. It's about as big as a football field. And it's very important to us because this is essentially the tube, as Dr. Sweetert said, that allows the outside world into the inside body. And it's very important to you because the way that you're designed, because of that introduction, 75% of your immune system falls along your gastrointestinal tract. 75% of your immune system. So here we're looking at how to keep diseases out. And if you're not having a healthy digestive tract, it's going to bring in the toxicity, bring down your health. You're not going to be able to withstand or compensate for as many things in this life that you lead. So, gastrointestinal tract, second largest body surface in the body, and 75% of the immune system. The condition of this organ is maintained by its unique balanced microflora. We call this eubiosis, meaning a balance of the microflora in the body. It is essential to optimal health. In addition to digestion and absorbing and eliminating food substances and nutrients, the gastrointestinal functions are critical. It's a critical barrier between the internal and external environment. So let's bring up a slide now to show more of the gastrointestinal system. What you see in front of you is a gastrointestinal system. You see it opens up in the face as the mouth and travels on down through the upper part of the body, past the lungs and the heart. And as we pass through the diaphragm, which is about halfway between the top and the bottom of your body, you see first in gray there, you see the liver. Now the food doesn't travel through the liver, but the liver is an important detoxifying organ. The next organ down that you see there that's tucked in behind the liver is the stomach. And as your food passes through that, you're digesting, actually up in the mouth, you start digesting your carbohydrates. But as you get into the stomach, you start to digest your fats and your proteins. And then the stomach dumps all that into your small intestine where absorption starts to take place and more mixing of enzymes to break down these foods into their basic building blocks. We're talking about proteins are being broken down into the individual building blocks, which are called amino acids. Your carbohydrates are broken down into small sugars. They're basic sugars of either one or two molecules together to be absorbed. We break them down into very small building blocks, and it's necessary for that to occur so that your body recognizes them as building blocks, not as something that came from somewhere else, okay? Because then we'll have an immune reaction to it. Can we go back to the slide in a moment? This intestinal tract, as it travels down, remember, if you look at the slide, there's round circles to the left of your screen. The top shows the inside of the intestinal tract, and as we go down, we start focusing in closer and closer to that internal surface of the intestinal tract. If you see the second one down, there's a large bump. And as you go down into there, it has a bunch of bumps around the sides, and you see on the third circle down, it gets even closer. And then the fourth one down actually shows you the cells that are in there. And if you look very closely, you can see some hair. Well, it's not actually hair, it's called cilia on the side there. And they call that the brush border. And that's what brushes along the nutrients, gets them closer to the cell membranes so that they can be absorbed. And your body needs certain things to be present for that absorption. Actually, fats are absorbed quite readily because they are fat soluble and the cell walls are made out of fat. So like we said, fats are absorbed at about 96% of all the fats you eat are absorbed. Then you get down to carbohydrates and proteins, which actually need the presence of sodium in order to be absorbed. But then your minerals need proteins to be absorbed. And so having those matched up with proteins as you ingest them is very important for that and an acid base. Let's move on. Dr. Sweeter, would you please?
Thank you, Dr. Jensen. Just kind of sitting here enjoying the talk and looking at how the different elements that we eat and consume are absorbed into the body, and I think our listener audience is informed too. What I'd like to do is, in just a moment, is call up that detoxification slate and slide, because I want to show what happens to the body and how adverse things affect it. And what is important about the detoxification slide is that person is kind of laying over and being affected by it is to say that there are external as well as internal effects upon the body. And some of the things that are external, if we look at the slide at the top, these are the factors that can affect our health. You know, this person is kind of slammed down and they're in a kneeling position and they're in trouble. But let's look in the upper left-hand corner. Of course, we see that there are foods that come from trees and roots, and they grow in the soil. And you can see that there are some broken drums and waste products on the left. And of course, toxicity can come from pollution. And think about it this way, a lot of the sludge and waste products that are being dumped into our land eventually get into our soils. In fact, in some of our major food-producing regions, we're becoming really concerned about what we call xenobiotics. These waste products and remnants of drugs that are getting into the soil, in our water supply, that gets into our soil, it goes into the plants, and then the plants are fed to the animals, and then the animals absorb these products, and then we eat the animals and or products, and then we become polluted. Going back to the slide, other things that we can see that affect, of course, in the middle you see the hamburger and the french fries and the Cokes, and of course, without getting into great detail about that, you know, in our Western society, we're eating more and more of our food out, and of course, we don't really know how clean a lot of those foods are. In the upper right-hand corner of this slate, you can see a factory and pollution going into the air, and of course, if you would say that there's one thing that we can't really live without for a very long period of time, and that would be oxygen and air. And we know that our government is concerned with the EPA and other agencies about how clean our air is. Why? Because asthma and other types of respiratory diseases are on the increase, and of course that affects not only our quality of life, but the economics of what we have to deal with and get by. As we go back to the slide, I'd like to just run through how this detoxification process works. All these factors go down to the lower left, as you see 1A. These pollutants get into our gut lumen, as Dr. Jensen was talking about the hair fibers and cilia. They get in there and they get absorbed, and they go up and into 1B, and of course then they get transferred and sucked out, and they go over to the liver, which is right under 2B. The liver is probably one of the major detoxifying organs of the body. We know that it does over 400 known functions, and I would guess that it probably does even more than that we just don't know the microscopic detail of it yet. As we move over to the right to 3B, these toxins get absorbed, and then they get into the system, and we go down to 4. And what is that little organ over there? Well, it could be the thymus, it could be the immune system, part of the immune system. It gets absorbed, and it affects the function of the body, and it gets affected that way. Going back to the liver for just a minute in the center, the liver, as we said, one of the larger detoxifying organs of the body. It can shuffle off to the right under 4A, which would be the kidneys. And of course, ultimately, the body wants to waste these products out, and it does it through the urinary system and the bowel as water and other byproducts. So the detoxification is so important that we really can't live without it. I think if we bring up our next slate, we're going to look at, Dr. Jensen's already alluded to it, some of the breakdown as where does this food go and how is it affected into the gut. And I think this is really interesting. You know, as we eat food, it goes down through the esophagus, it goes into the stomach, and from the stomach it goes into the intestines, and it kind of looked like that big loop there as we were seeing on the slate. It has, remember that there are various muscles, you know, as the bolus of food and things that we eat is moved through the intestinal tract, it is layered with muscles. I mean, it's just kind of like, that's how it gets there. And so these muscle layers move the food and the products down there. As it goes from the stomach, you see a picture here of the stomach in a cutaway section. There's muscle on the outside as it churns it and mixes it up. And in the stomach lining, there's a mucosa. Of course, that's important because there's a lot of hydrochloric acid. pH of the stomach is about 1.5, so it's very, very acid. And the importance of that is it's part of the breakdown of proteins and minerals and so forth before it gets done, because interestingly enough, there's different pHs of the intestinal tract from the mouth to the elimination. And in the stomach, it's very high acid content because it has to break down certain of the food factors so that they can be absorbed. But as we get down into the lower part of the intestine, this large and small intestine, the pH has got to change. It's got to be more of an alkaline pH. And so there are certain elements that are better absorbed in that phase. So going back to the slate here, as we look through, the food bolus goes from the stomach, it goes through the pyloric valve. It's kind of like a one-way valve, goes through the duodenum and on down through the tract. Now as we go to the next slate, we can see that it moves from the duodenal bulb, of course, the common bile duct, which comes out of the liver, delivers factors that will help break down fats. We'll also see that the pancreas, through the pancreatic duct, releases factors to break down certain parts of the food products. Again, all this taking within the small intestine there. Now the next slate that we can show as is toward the elimination end. And it comes down the colon into the sigmoid colon and the rectum, and as our viewer wrote in there, she's had a lot of gas, a lot of problems. She said they don't have any polyps. She said, well, of course, polyps can occur in a lot of different areas, but they're commonly found in the sigmoid colon there. Polyps are being big pockets that collect food and debris and can create all kinds of problems. Sometimes, if it's bad enough, it actually has to be removed surgically. And then, of course, the sphincter muscle is down by the anus that controls and holds the bolus in until we're ready to eliminate it. Very important as we look through this whole series, from the beginning to the end. Think of it, it's a machine, it's a biomechanical part of our body, and it's important that these phases of digestion be working properly. And so that's in the beginning of our show. We talked about some of the tests that would be the help to tell us how the health is of our organs and of the digestive tract in particular. Now I'm going to turn it back to, who wants to take the next
I
slide?
can take it.
Dr. Lala.
What Dr. Sweetert and Dr. Jensen have been referring to is that really the intestinal system is its own ecosystem, and that we do have, as Dr. Sweetert said, normal bacteria and normal viruses within our intestinal system to try and they're there to maintain that ecosystem and to fight off the bacteria, viruses, protozoa, et cetera, that we encounter throughout our day. And so sometimes not only are the diagnostic tests of significance, but sometimes we need to supplement our diet with what we call either a prebiotic or a probiotic product. These would be normal bacterium that would increase intestinal harmony, increase health within the intestines. But again, if you're eating foods that unbeknownst to you you're allergic to or hypersensitive to, you continue to take them into your body, not recognizing that your body says, oh my gosh, there are antigens within those foods. Usually it's in a protein. We don't know about that. And our immune system says, wow, this is bad. So it secretes antibodies. So we have an antigen-antibody reaction. And by determining both the fixed and the cyclic, or the delayed food sensitivities, and Western medicine basically checks for fixed allergies. Like, I don't have to have a blood test to tell me that I'm allergic to dog or cat dander if I start to sneeze and get a runny nose. But we have cyclic ones, or delayed food sensitivities, that we're not aware of, that when we eat those foods, maybe 2 or 3 hours or even a couple days later, we start to have a headache or a psychological problem, become depressed or something like that. And it's really because those toxins or those toxic byproducts from the food have been absorbed in our gut, up into our blood, and they go off into the body, and they cause then what we call systemic diseases, such as arthritis or chronic back and joint problems, or psychological problems like depression or anxiety. Or it could be like fibromyalgia, or it could be high blood pressure, or contributing factors to other conditions such as like diabetes. So what we've got for you, if you like, if you want some information, further information on good health information, you can always write us or email us looking for a booklet that we have for you. There's no charge for it. There's nothing to sell there, called Ultra Glycemic. You can find it out on our website. Remember, you are in charge of your health. You really are.
Fellowship of the Great Physician, through its School of Health and Healing, provides classes each Thursday evening from 6:45 to 8:30 at North Heights Lutheran Church in Roseville, Minnesota. There is no charge or registration fee for these classes, but free will offerings are received. The major emphasis of these classes is on biblically based spiritual health and healing, with a brief teaching on physical health and healing. For further information on the School of Health and Healing or the topics discussed on today's program, visit our website at www.greatphysician.com or contact the Fellowship of the Great Physician in care of Dr. Lala or Dr. Jensen at 2353 Rice Street, Suite 210, Roseville, Minnesota 55113. Telephone 651-484-8521, or in care of Dr. Sweetert at 3936 Jackson Boulevard, Rapid City, South Dakota 57702. Telephone 605-342-3861.